Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to talk about cataract surgery and I'm going to show you a quick video about how cataract surgery is performed to help give you a better understanding of what is involved with this procedure and how delicate the procedure is. But before we start looking at the video, I've just got a quick photo of the setup, so we've got a rough idea how the operating room is set up. So so on this picture you can see below we've got the cataract machine in the left hand corner, which is quite a sizable machine. We've got a massive, great big operating microscope which gives us the ability to see everything at high magnification. There's certain parts of the procedure where you need to have up to 20-fold magnification of what you're seeing. Obviously the patient, which is underneath the operating microscope, which is draped up, and the surgeon, and in the right hand corner we'd have the anesthesia team, which isn't illustrated on this photograph. But let's dive into the video. So we can see the eyes all draped up. We're going to make a small incision, which is about a millimeter thick, into the eye. Where they're going to fill up the eye with some adrenaline, and then we're going to put a small air bubble in and some blue stain. You can see a bit of reflection here from the fluid which is accumulating over the eye. Right at the bottom of the picture you can see a little wick which is there to try and get rid of all the fluid from the eye. And now we're going to inject some medication into the eye, which is going to fill the front part of the eye, called the anterior chamber, and give the eye a lot more stability. And now we're going to make a second incision. This is about 2.8 millimeters across. This is just one way of doing it. There's a lot of surgeons who will only do an approach through one hole. This is a two-hole procedure here. And then we're going to use this special knife and a special incision to create a self-sealing wound in the cornea. And then as you can see, we've also created a small hole into the front part of the lens here. So we're opening up the capsule that contains the lens. You can think of that a bit like a Smartie or an M&M. So we've just cracked through the outer shell and we're now getting access to the inside chocolate. And now we're tearing this very, very thin membrane. This is about 0.05 of a millimeter thick. So this is a really, really thin structure that we're tearing here. And although it looks very easy on this video, it's actually really the most difficult step to learn to do. This is a slightly older patient, so the lens capsule is a bit thicker already, it's a bit harder to tear. Making sure that this doesn't run out, so we're going to pull this back in again, and there we go. So now we've got a small hole that we're going to be able to operate through. This is what we call the phaco needle, or the cataract needle. So within that handpiece we're pumping fluid into the eye, and then we're sucking out the lens material, and then the tip is moves forwards and backwards extremely fast, about 28,000 cycles per second, and by doing that it creates heat which will emulsify or kind of melt the lens and smash it up into smaller pieces. So in this case we're making several grooves into the lens, basically to crack it up into smaller pieces. Spinning this around again, and now we're going to go in with a second instrument, and then we're going to crack those pieces that we've grooved into smaller pieces. Going to flip it around again, and then once we've got a few loose pieces, we're going to then use the phaco needle again to smash up those smaller pieces into fragments which are going to be able to go through this very, very small needle. Going to turn this round, crack a small piece off again, and this is what we call a two-handed approach. And you can see the cataract needle is eating its way through this cataract, smashing it up into smaller pieces. getting smaller and smaller. We're now starting to see a nice green yellowy reflection from the back of the eye. And that green yellow reflection is from the structure in the back of the eye, which gives animals the ability to see better in very dark light conditions. Only a few small pieces left over. There's one piece here, going to get rid of that. And there we go. And then the piece you can see at the back, this is the even thinner part of the lens capture from the back of the eye, and that's something which is very delicate and which can break quite easily. And now we're going to go in with some different instruments. These are what we'll call irrigation aspiration handpieces, and we're now going to remove the last remaining what we call lens fibers, which are just beneath this capsule. It's very satisfying to do. So removing all of that, kind of hoovering out all the rest of the lens material. So we've done that. Now we insert the artificial lens. This is a special type of lens which should give dogs the ability to see between ±1 diopter of normal vision. So it's a sort of a fairly standard lens. So it's going into the eye, and now we're going to use a special hook to position it and unfold it. So we're turning this around. And then once we're happy with the position, we're then going to close up the cornea. So in a human, you wouldn't have to stitch up the cornea. This is only for animals where the cornea is a lot softer, it's a lot bigger, so it's much more likely to collapse if you don't stitch the cornea up again. As a human, you wouldn't have to do that. The incisions they use in humans is a lot smaller. The human cornea is a lot more stable as well, so that's why cataract surgery in humans is a little bit easier from the technical aspect of doing the procedure. And then this is a special type of suture pattern. This is there to try and stop any leakage. The suture material we're using here is about 1/3 of the size of a hair, so it's an extremely thin suture material, but it's also very strong, so it does keep the cornea together amazingly well despite the small size. And now we're going to do the second port. So we're just pre-placing these stitches. And now we're going to go in with these irrigation aspiration hand pieces, and we're going to remove the rest of the jelly that we've injected at the beginning of the procedure. So these are kind of the finishing touches of the procedure. Just repositioning that lens to have it nice and centered. And then once we're happy with that, we're going to tighten up the stitches. Just going to make sure that there's no leakage from that, so we want to make sure that the eye remains nice and stable throughout the whole procedure. Now we're going to tighten both of these up. and now we're injecting some antibiotics into the eye, and then we're going to do a second injection of a medication that will constrict the pupil, so to try and avoid any pressure problems after the operation. And then once we've done that, we're going to close the second port. And that was it. So this was a fairly straightforward cataract procedure. There are some cataract procedures which are more challenging, more difficult, but this is something that we would expect in a fairly straightforward case. So hopefully that gives you a rough idea of how cataract surgery is done. Like I said, it's very similar to humans, but there are obviously some species difference between humans and animals, but this is what we do on a day-to-day basis. So thanks very much for watching, and stay tuned for the next video.